burn clinic at Children's National Health System will oversee your child's care as they continue to heal. Each visit, we check in with you and your child to make sure your child's burn healing is on track. In order to be treated in the clinic, you are required to obtain a referral from your primary care provider. Even if you were seen in the emergency room, admitted inpatient, or seen in another one of our clinics, your primary care provider must provide you with a referral before we are able to treat you. Be sure to make an appointment if you do not already have one. The clinic is open Monday, 8 a.m. to noon, Wednesday, 8 a.m. to noon, and 1 p.m. to 4 p.m., and Friday, 8 a.m. to noon. We cannot accept walk-ins, so please be sure to set up your appointment as soon as possible to ensure we have you covered. Before you come to clinic, it's best to do the preparation steps to make sure your visit is as smooth as possible. Step 1, plan to arrive at the hospital at least 30 minutes before your appointment to allow for parking and checking in at the welcome desk. Step 2, pack a comfort bag. This is all the things your child may need to ensure they can remain comfortable. A blanket or toy they love, a pacifier, snacks they like to eat, a book they like, or any tablet with games or music they enjoy. We want to make sure they are comfortable and easily distracted to keep the experience positive. Step 3, be sure to bring with you any first aid treatments you may have applied to the burn area, along with any paperwork you may have from being in the hospital or the emergency department. Your child's burn will be cleaned and the dressing changed during their visit. Step 4, provide pain medication prior to your visit as prescribed by your healthcare team. We find that it works best to give the pain medication as soon as you check into the welcome desk. Our elevator system may be different than you're used to. To get to the burn clinic, take the main elevators. These are located in the check-in area with the hot air balloons. From the screen outside the elevator, select 4. The screen will then tell you which elevator to use. The elevators will only take you to the floor that was selected on the screen. Now that you've gotten to the hospital, let's talk about your burn clinic visit. Upon your arrival, you will meet with our front desk team. They will work with you to make sure your referral is completed and any additional registration needs you may have. At your visit, you will meet with one of our specialized burn nurse practitioners. They will assess the burn and come up with a treatment plan.
At your visit, we're going to ask you about your child's medical history. Things like, does your child have any allergies? What medications is your child taking? What is the status of their vaccinations? Has your child had any fevers? How much is the child eating and drinking? If they are in diapers, how many wet diapers have they had in the last day? Has there been any changes in behavior? How would you rate the child's pain? Are they using the injured area and are they staying active? If you cannot attend the clinic visit with your child and you have to have someone else bring them to clinic, that's okay. We just want to make sure that they have the ability to answer all of those questions on your behalf. That person who you designate to bring your child will need a letter granting them permission to bring your child to the clinic visit. You will also meet a child life specialist who will work with you on developing techniques to coach your child through the dressing changes. You may meet with members of our physical therapy and occupational therapy team if your child has an injury that is affecting the way that they move or affecting their function in any way. You may also meet with our child psychologist, who is there to support you and your child's emotional well-being. Across this team of specialists, we're here to help you get through this dressing change with all the support you need and do it as quickly as possible.
Some things to remember going into the dressing change: the fear of being in the hospital and the strangers surrounding your child may be what is scaring them the most, and that's totally normal. You are the safest person to them, so having you with them at bedside during the procedure will be the most comforting thing to them, and Child Life will be there to support you and your child as well. When Child Life enters the room to meet you and your child, we're there to see how they're coping with the procedure, see if this is their first dressing change in clinic. We're able to prep them for what they may see or feel, and we can also help distract them. Some children do better seeing what's going on. Some children prefer not to watch, and that's where we can help distract them and provide alternative options for them, so they're focusing on something fun and not the dressing change itself. Most important thing to remember is that you are the coach. You are the safest person to your child, and we want to make sure that you are comfortable supporting your child through this process. It may be helpful to reward your child for good behavior for remaining still during these dressing changes. Rewards can be taking them for ice cream after a dressing change, going to the park, letting them stay up 10 minutes later. It does not always have to be a tangible toy or item.
Most commonly, we will see you every 5 to 10 days to check in, assess the healing process, and make sure you have the supplies you need to take care of the burn. Before you leave, you will schedule your next appointment with our front desk team. We will provide you with most of the materials you will need to continue the treatment at home successfully. We recommend that all children wear sun protection after their burns are healed to prevent sun exposure to the burns. Sun shirts are the type of clothing that's usually made with nylon and elastane or polyester, and it's a stretchy, breathable fabric that most importantly provides ultraviolet protection in a range anywhere from 30 to 50%. You can get sun shirts at a lot of retail locations or online. We provide sun shirts to every child that has a sunburn in a location that would be covered by the shirt, such as their arms or their chest or their back. We will provide you with any prescription needs as well. Please call us at 202-476-5221 or email us at npsurgery@childrensnational.org if you have any questions or concerns.